Have you ever had a patient that was really excited about the treatment plan that you presented? They were ready to get started, and next thing you know, they say, I'll think about it. I'll call you back. Well, inside of today's training, you're gonna learn exactly how you can get more patients to get started right away, as well as to be able to get confidence for your team and to increase your production per visit. Hey Dental Boss, Anissa Holmes here, the founder of Delivering Well in the Dental Boss Movement, and I'm here each and every Tuesday showing dentists just like you how to run and scale a successful dental business. Subscribe to my channel and hit the bell to be notified when a new episode is released each and every Tuesday. So today we're talking all about treatment plans and how we can get patients to understand how they can fit dentistry into their budgets, while also getting your team excited and motivated about helping our patients find solutions. Now, before we get started, I actually have a question for you. If you had to go to the dentist 7 times or 4 times, would that be hard for you or would it be easy for you? I can tell you, for me, I know it would be super hard. And what we have discovered in my own practice is that our patients, either they are business owners, they are self-employed, or they work for a company. And so it's really hard for them to actually get away from multiple visits as well. And so what I'm gonna be sharing with you is what we actually implemented in our practice. And this has allowed us to be able to not only be able to get our patients to get started with treatment, but to give our team confidence and to increase our production per visit as well. And so this is called the Treatment Plan Case Acceptance Framework, and I'm so excited to share it with you. So how it works is, as you're presenting a treatment plan, perhaps a patient is recommending, or you're recommending for them that they have 4 crowns and maybe 4 fillings. And so as you are actually discussing the treatment and presenting it to them, you would say something like, Mr. Joe, you actually have 4 crowns and 4 fillings, and we can schedule this a few different ways. Now, what we have discovered is that for many of our patients, either they are a business owner or they're self-employed or they work for a company, and so it's really, really hard for them to come and actually hold themselves accountable for coming for multiple visits. And so what we've actually done is we've actually created longer time blocks for them to actually go ahead and get their treatment done. Now, question for you, is there any reason why you wouldn't be able to get all of your treatment done in one visit? Now, we know that typically people are gonna respond 1 or 2 ways. Either they're gonna say, that really makes a lot of sense, like it would be super easy for me to just come one time, get it out of the way, or they may say, I would love to, but I don't have the money, right? And so because we know that many patients are going to respond that way, then now we can actually be prepared to go ahead and offer some solutions. And so this is what I would say. Mr. Joe, you're actually just like most of our patients. Most of our patients are not able to pay out of pocket in one visit. But how our patients are able to actually get all of their treatment done in one visit anyway is, number one, they realize I have a credit card, perhaps even a 0 interest credit card. And so they're able to actually get all of their treatment done in 1 or 2 visits or very few visits, and they actually pay it off over time. What other patients choose to do is perhaps they don't have a credit card, right? Maybe they don't have that option. And so what we're able to do for those patients, what we're able to do for you is to allow you to actually go ahead and get all of your treatment done, and you can actually pay off a little bit over time. What works really well for other patients is we actually just sit down and we actually make a plan. And so we're able to look and see everything that needs to be done. We determine how many visits we're going to do it in. And now you can go ahead and pre-schedule actually all of your visits so you get priority of day and time. And guess what happens? We can now make sure that you know your schedule. You can go ahead and plan, on the 15th or the 2nd Tuesday of every month, you're gonna come in, and you can go ahead and actually plan your budget, and that holds you accountable. So those are the 3 options that typically works really, really well for our patients, and it's how they're able to get their dentistry done so that things are not slipping through the cracks. What are your thoughts? Which one of those 3 options do you think works best for you? right? At that point, we have the patient to really understand that there are solutions. There are ways that they're able to fit it into their budget. And then they'll say, you know what, tell me about number two. I didn't know that I could pay this off over time and actually get it done in one visit. And so you can now explain, well, your treatment plan is going to be $5,000. And if you split it up, we can actually have payments as low as, $79 a month. Does that work for you, right? And from there, you can go ahead and set it up. And so using this framework is really, really powerful. It allows you to provide solutions for your patients. It allows your team to feel confident that now they're providing solutions, and it allows you to also do more dentistry you love. Now you know why helping your patients find solutions is important to your success. Tell me in the comments below, what was your biggest takeaway? Now that you've gained clarity on the things to focus on with your case presentation, it's time to hone in on exactly what to focus on. If you haven't already taken advantage of my free treatment planning checklist, check out the link below. And if you're ready to join a community of dental bosses just like you, I have a Facebook group where dentists come together for support and action-taking tips and motivation. And as always, if you like this video, please let me know by liking it below, subscribe, and share it with your fellow dental bosses, and comment below with the hashtag, I'm a dental boss, if this video helped you.